Hello there, my darling. Hello. Are you feeling okay? Are you comfortable there? All right. I'm just going to take down some standard notes. I'm sure you've had to give these to lots of people. Sorry about that. But let's just run through them to make sure that I have all your details correct. All right. Can you tell me your name? Yep. Age? First line of your address. All right, that's the formalities out of the way, just to make sure you are who it says you are. Okay, right, now, it says here that I have you in because you've got a very long-term muscle strain. Is that correct? All right. And when we say long-term, how long do you think that's been for you? Okay, but this strain happened how many months ago? 4 months ago, and it's actually steadily got worse. Right, okay. Really, you came to us when, about 6 weeks ago? 9 weeks ago, right, okay. All right, I see. And it's just continued to increase in pain since then. All right. Let's see if we can't get this fixed, eh? Can't have you walking around like this. Certainly doesn't seem to be the way to go, does it? Now, can I just make you a little bit more comfortable? Okay. I'm going to just pop some gloves on. Give me a moment. I'm going to have just have a little prod around there. That'd be all right with you? Good. All right. I'll be as gentle as I can. I'm sure you've realised already that I'm a very, very tender nurse. Absolutely. Now, shall we get in a little closer? All right. What I'm going to do, if you'll just bear with me, I know this may cause a little discomfort, but I just need to get a gauge of how you're doing, all right? So I'm going to take the palm of my hand, and I'm just going to place it against your face. And if you could, just put a little resistance against it for me. That'd be all right. All right. Let me just bring this in. I just come into here. Right, I'm going to hold my glove there, and if you wouldn't mind, resist. Push a little more. Okay, and that's all you can do on that side? Okay, all right, just to get a little bit of a baseline, should we just come in over here? I'm just going to pop my hand, there you are. Just lean onto that for me. Lean. That's much better. So you have a much wider range of movement on this side, on your left side. Okay. All right, can you do me a favour? And again, I'm sorry if this causes a little discomfort at the moment, but if you wouldn't mind, you can just follow my fingers for me. I'm just going to take them up. Will you just follow them up? Looking at them all the way up. No, that's not so good. Let's go over there. Better, much better. And if I can just bring them across here, can you just follow them across there? All the way across, you've got that? Okay, not so much range, and let's bring them back. Bringing them all the way across. Yes. Okay, I'm sorry it causes discomfort when we move to that side, but I do need to get a little look. Now I'm going to come in a bit closer and just have a feel around the muscles. Will you be okay with that? All right. Okay. Now, don't worry. I'm just going to come in here. Can I just come in? Let me just get a little closer for you. All right, here we are. Now I just want to have a little feel around here. Okay. I'm just going to bring my hand around your neck a little. You all right? Good. Okay, let's come over to this side a little, shall we? Just want to just have a little feel. I'm just going to take my hands around both sides. You'll just feel a gentle bit of pressure as I press onto the muscles around the neck. Oh, I'm sorry. I'm so sorry. That's obviously quite painful for you. All right. Now, looking at that, obviously you do have quite an extensive pain site there. So can you give me, on a scale of perhaps 1 to 10, where you feel that is with pain? So when you're turning to the right, which is your good side, what are you saying? Do you feel any pain? A pulling. Okay. And the pulling is at, what would you say? 0.5. Okay. And then if you're pushing your head over to the left-hand side, what are we talking about then? Between a 7 and 8.5. Yeah, I mean, that's far too high. Certainly can't go around living like that, can you? And so you're finding you're unable to drive because it's difficult to move your head. I'm so sorry. This is really impacting your life. We're going to get you sorted so you don't have to feel like this anymore. All right. Please don't worry. So I'm going to recommend a couple of different things. So I'm going to send you home today. We'll work through which of the options of medication is good, but it's going to be 3 gels, and you'll be able to buy any of these over the counter. But of course, I'll send you home with one today. We're also going to be doing some manual manipulation. That's going to take a few weeks, I'm afraid. I'm going to have to see you every 3 days for the next 2 weeks, so this could be a little grueling, and then hopefully once a fortnight after, and we'll gauge where we're at there. How does that sound? Excellent. Good. All right then. Well, I'm going to show you some options that we can work with today. So one of the things I would like to consider, have you been trying the hot and cold on your neck? Have you been using perhaps a hot water bottle, perhaps a cold pad? Have you tried any of these yet? You tried some cold peas. Okay. Well, I don't think they're quite the option, but it's all right. I'll show you some. So, right here, what I have here is a warm bean pad. If I just bring that nice and close, you can hear the sound that makes. It's a lovely sound. Almost sounds like rain on a cold autumn day. Or perhaps crunchy sand beneath your toes. And if you're going to have this close to your ears, it's nice to know that it's a smooth and soft sound. So this can be popped into the microwave, warmed up. It's just full of beans, like me, full of beans. And we're then going to open it up, bring it round, and place that carefully along the neckline. How's that? Now, tell me, how does that feel with the warmth on your neck? Right. Good. Ah, so you've got an instant relief. That's good. Okay. Now the object of this treatment will be a little bit harsher than that, I'm afraid. So I'd like you to be sitting. Do you watch TV of an evening? Lovely. You can sit with the warm pad on for maybe a couple of hours, but I then want you to take that away. So I'll just gently throw that away for you. And this is where I explain there's going to be an option. So this is a very commonly found medicine. So this is just a vapour. And if we take the lid off, you'll see, pop that in there, a little sniff of that. That's very commonly used eucalyptus. It's going to give a warming to the skin. It also keeps it quite clean. So this is an option, but I'm feeling that because it's been a prolonged pain, we might need something a little stronger. So that's for a warming of the skin. Now, this is also your very classic Tiger Balm, which can be used alongside the other medications that I'm giving you. So if you'd like to get yourself a pot of this, it can be extremely helpful, especially if you're prone to these muscle strains. I read on your notes that you used to do triathlons. Yes, so I'm imagining that you've put great pressure on your body over years. I'm sure. Now this is what I'm actually going to be prescribing out for you today. So this is, as you can see, cold gel. And what you'll be doing with this is just slathering the blue gel onto your neck. So I've popped a little bit of my glove here for you to have a look at. So if I just bring that in a bit closer, that's a liquid gel. And ideally, I want that massaged all around the offending area. And this is going to be nightly. Yep, every night. So should we take a little of that and just begin to work it in and around the left side of your neck. There's actually quite a lump here where the muscle has knotted so tightly, so we can really, oh, I'm sorry if that's painful, but we can really work into that. Let me just get right round the sides. There you are. Oh, that's fabulous. There we are. I'm just going to take a little bit more off the top there and just, there you are. And you want to keep this quite localised because it is going to make your skin feel freezing cold for just a little while, not too long. How is that? Is that all right now? Good. Excellent. Okay. All right then. Let me just take a seat. Should we just slip these off for a moment? There we are. Now, how's that feeling to you? It is quite tingly, yes. I'm afraid that is going to be the downside. It's a symptom of the cold gel, is you get quite a tingling sensation, which may then result in an almost burning sensation on the skin, but I assure you, you're not burning at all. It's just a byproduct of the gel. Okay. All right. So last of all, what I'd like to do, and this is going to be the treatment that you and I will have every day for the next 2 weeks. Yes, 3 times a week for the next 2 weeks. And then we'll follow that up, hopefully, cross fingers, all goes well. We'll be following that up with once a fortnight, and then hopefully less than that. I'm just going to pop on a second pair of gloves for you, and then we're going to do the last part of the treatment that I'll be working with you each time. All right? Lovely. So I'm just going to put these on. There we are. I don't know how you've managed for so long in so much discomfort. Why didn't you come earlier? That's not an excuse. Life does not get in the way of looking after yourself. Not one bit. So, as you can see, we're going to be working with a very deep tissue massage. All right? And I'm afraid you are going to have to take some deep breaths for this one. All right. So I'm just going to bring that in there. Okay. I'm going to begin working in now. That's it. Just working around the side. Beautiful. That's it. Running up, down the length of the neck. There you are. Great job. Great job. You're managing this really well. I can actually tell. This is very uncomfortable. There we go. Don't really enjoy causing you so much pain, but sometimes it's a necessary evil if we're going to get you all back on track again. Wouldn't you say? Yes. All right. Okay. I think that's enough of that with the deep tissue. Let's go in again with my fingers. Just working their way around that strained muscle. Really working your way in now. And I think that's it for today. I think that's the best we're going to manage for today. Oh no, you're very welcome. I did try my very best to be gentle with you, but it can be a bit difficult. I do appreciate that. Can I just take a little gauze, just clean you up a little bit, shall we? Should we just take that and just, there we are. Let me just clean all around your neck. Sorry about that. I made quite a mess of you, didn't I? Not unusual, I have to say. There we are. Just put that there. Now, I've got you booked in 3 days' time. Are you alright with that appointment? Fantastic. Well, I cannot wait to see you. Until then, rest up, stay cozy, and happy listening, my darlings. Shh. Hi there. I just wanted to come in and say thank you so much for watching today. I am so grateful for each and every one of you that has subscribed to my channel, and if you haven't already, please do press that notification bell, subscribe, and comment because I love to hear the comments from you guys. I'm just a baby channel and still building, but I would truly love to keep bringing you this type of creative medical work. Happy listening, my darlings, and thank you so much.